Greater Manchester residents are facing their first day waking up to it this morning under the toughest coronavirus restrictions. And joining Lancashire and the Liverpool City region, while we now know that Stoke, Coventry and Slough will be moved into Tier 2 from tomorrow.
The government's three-tiered COVID alert system has been called corrosive by the Labour leader Keir Starmer, with suggestions it's creating a north-south divide. We're joined now by Alan Milburn, who served as former Prime Minister Tony Blair's Health Secretary and is now Chancellor of Lancaster University, where students are currently under Tier 3 restrictions. Good morning to you. Thanks for joining us this morning. What do you make of how the tier system is working in that case? There are those who have said it's fuelling the north-south divide. Do you back this idea for a circuit breaker, as Keir Starmer suggested?
I think there is merit in the circuit breaker. I mean, what worked, I think, in the first big national lockdown is two things. First of all, there was total clarity. We all knew what we had to do. This time round, frankly, it's a bit more confused or at best ambiguous. But the second thing that really worked was that it was universality. We were all in it together. We knew that it was going to be a shared sacrifice. And I think the risk of what is going on, and in particular, the fight that the government picked earlier this week with Andy Burnham in Manchester, the risk is that it corrodes that sense of national unity. That if people start feeling that somehow or other they or their area are being treated unfairly, that's not good, obviously, for national unity, but it also puts at risk the idea that people should comply, because they start saying, well, hold on a minute, why should I have to do it when others aren't? So I do think the first duty in this sort of situation on the part of government is to ensure that national unity is maintained and not undermined.
Well, that's one interpretation of it. I mean, other ways you could look at it is that Rishi Sunak delivered a lot of what Labour have been asking for yesterday, including backdating the support for the most affected areas to August, bringing the money up. He could have had that in mind all along and just didn't want to publicly give in to Andy Burnham in that way. So it puts Labour in a tricky position now, doesn't it? Because they have taken a stand against the government, which now seems to be delivering.
Well, I think the Chancellor should be bigger than that, frankly. I mean, to argue and create a spat over 5 million quid.
Well, it
when
wasn't
the following
the Chancellor,
day,
was it? It was Number 10 that did that. And Number 10 argues that it was as much Andy Burnham arguing over 5 million. They offered 60. He wanted much more, but was prepared to settle on 65. Both sides were at a standoff on 5 million, not just the Prime Minister.
Well, I think in the end, the Chancellor holds the purse strings. It's his responsibility. And he loosened them the following day, which does seem on the face of it a bit absurd. But look, what we can't get into here is the sort of politics dictating what happens health-wise or what happens economically. And the real worry, of course, is not just that you've got this ongoing health crisis, which is, quite unprecedented, of course, and extraordinary. But you've also got the economic crisis. And I mean, my big worry is that, when you get a recession, what tends to happen is the big losers tend to be young people. We know that the big losers, generally health-wise, tend to be older people as a consequence of coronavirus in terms of the health impact. But the big losers economically and socially stand to be young people. 60% of the redundancies that have taken place so far as a consequence of the COVID pandemic have been amongst the young. And they're often in the sectors like hospitality and leisure, which are most badly affected. So what we need to do is to make sure, particularly in those areas that are most affected, the maximum level of support, not the minimum level, the maximum level of support is being given. And people generally supported the furlough scheme last time round for a very good reason, that it was fair and it was universal. And what I don't really understand is why that hasn't continued.
Well, talking of young people, in your position as Chancellor of Lancaster University as well, what's your take on bringing back university students when that happened? Because that does seem to have led to a rise in cases. We know at Lancaster University around 1,000 students were self-isolating earlier this month. 147 new positive tests had been reported in the 7 days up to the 21st of October. Do you think that was the right way to do it? Has it created additional pressures that have led to the increase in cases that we're seeing, again, with older ages as well now?
Well, I mean, we know how the virus works. It basically spreads when more and more people are in contact with each other, whether that's a workplace, whether it's a school or a university. So, of course, there's bound to be more impact. But I think in the end, it was the right decision to bring people back and to give students the opportunity of experiencing, university. And certainly at Lancaster, what the Vice-Chancellor, Andy Schofield, and his team have been trying to do is make sure that that experience is as good as it can be.
But are you happy with that? I mean, we hear there was controversy earlier this month with students who were self-isolating were being charged £17.95 a day for food parcels, and the parcels actually cost £4 to make, which doesn't seem a fair situation.
Well, it's obviously a difficult situation for everybody, but what the university is trying to do is to make sure that there's what we call blended learning available for people, so that they're not just stuck in their rooms all the time. There is the opportunity to get out and study face to face, and that's particularly important when you think of a group of students like medics, for example. You want to make sure that they are in the labs, but obviously, look, it's far from ideal. From anybody's point of view, and you really feel sorry in particular for freshers, the people who turned up at university earlier this month, hoping not just to have a great academic experience, but to have a fantastic social life as well. And that's a big part of it. And sadly, a lot of that hasn't been possible. But we will continue to provide, the appropriate level of support for students. They're the people that really count in all of this.
Because that's key, isn't it, in getting them to... I mean, young people, whether in work or students, have been blamed for a lot of the spreading of this. I think they must feel very unfairly. And we saw some research earlier in the week which showed the numbers in the northeast particularly was falling, which they'd connected to young people, yes, what they called the worried young, observing the rules. As Chancellor, what message do you try and get to youngsters? Because it's difficult, because there's also mental health issues, and you've got a rather fatherly role, haven't you, in that at this time, probably more than any other period of being a Chancellor of a university.
Yes, I mean, I think, it's unfair, isn't it, when one group are singled out as being the sort of super spreaders. And I think, some of the coverage has been really unjust. It's not students to blame for this. We've got an horrendous global pandemic going on. And, those guys, like everyone else, that we're all in the front line of it. And, we want to make sure that students at Lancaster and everywhere else are getting, the maximum benefit from their university experience. It's not an ideal set of circumstances. We're all having to find new ways of managing this. Tough
job being a Chancellor right now. Tough job being a health secretary.
Well, not really. I don't really have the hard job.
I was going to say, it's also a tough job.
Do the work.
Tough job. Well, that's very nice of you. But you've been a health secretary. Matt Hancock is the current health secretary. How do you rate his performance? What's he done wrong that you'd have done differently?
Well, look, it's an extraordinary situation. So, everybody sympathises with the predicament that decision makers are in. I think the real thing that they've just got to get right about all of this is clarity. And I mean, I do think, look, there's lots of things that are not right, test and trace being the obvious example, as the Prime Minister himself was saying just yesterday. But the most important thing is really to level with the public. And this is where I do think the government and Matt and others really need to up their game, because the truth about this virus is that it ain't going to go away fast. No. We're all hoping that there will be a vaccine and that the vaccine will be effective. But the likelihood of it being 100% effective, as Sage and others are saying, is very, very unlikely. So it's going to be with us for a long time. And, we're going to have to learn to live with it. And what isn't sensible is to declare victory before wars are won. That's what the Prime Minister did in the summer, and it doesn't look so smart now. So I think transparency and clarity and making sure that there is a sense in the country that we're all in this together, that is actually the most important thing that is required of political leadership right now.